Hey everyone, welcome back to my channel Medicosguide. This is Dr. Ida Khan, and here in this video we'll be continuing our lecture of breast cancer management. In the first part we discussed about surgical management, physiotherapy management, and radiotherapy management. And in this part we'll be continuing our other treatment options. So let's get started. First is hormonal therapy. Hormone therapy is a targeted approach for hormone receptor positive breast cancer. This type of cancer grows in response to hormones like estrogen and progesterone. The goal of hormone therapy is to block or lower these hormones in the body. It includes medications like tamoxifen, which blocks estrogen, aromatase inhibitors, which lower estrogen levels, and so on. Pre and postmenopausal women with hormone receptor positive cancers can get benefit from it. And the side effects of hormonal therapy may include hot flashes, fatigue, and joint pain. It's important to evaluate malignant breast tissue for the expression of estrogen receptor and progesterone receptor. And if these receptors are present, then hormonal therapy is given. While in their absence, hormonal therapy is not needed. Now, the drugs include for premenopausal women, these are tamoxifen and luteinizing hormone releasing hormone agonists, which are goserelin and leuprolide. Then for the postmenopausal women, these are tamoxifen and oral aromatase inhibitors, which include exemestane and anastrozole. Now let's discuss about the chemotherapy. Chemotherapy uses powerful drugs to kill rapidly dividing cancer cells. It's often used for aggressive breast cancers or cancers that have spread to other parts of the body. The types include neoadjuvant, which is chemotherapy used before surgery to shrink tumors, and the adjuvant, which is the chemotherapy used after surgery to destroy residual cells. Now let's talk about their administration. So, this chemotherapy is delivered intravenously or orally in cycles, and the side effects can include hair loss, nausea, fatigue, and increased infection risk. When to use chemotherapy? If chemotherapy is used after surgery, this is called adjuvant chemotherapy. If it is used before surgery, this is referred to as neoadjuvant chemotherapy. While if it is used for advanced stages, then this is referred to as palliative chemotherapy. Now let's discuss them one by one. So the first one is adjuvant chemotherapy. This is used after surgery to try to kill any cancer cells that might have been left behind or have spread but can't be seen. Now, neoadjuvant chemotherapy is used before surgery to try to shrink the tumor so that it can be removed with less extensive surgery. And now, the last one is palliative chemotherapy. This is utilized in advanced stages and it is used as a main treatment for women whose cancer has spread outside the breast and underarm area. First generation regimen includes 36 monthly cycle combined therapy with cyclophosphamide, methotrexate, and 5-fluorouracil, while modern regimen includes anthracyclines, which are doxorubicin or epirubicin. Now, biological therapy, also known as targeted therapy, focuses on using the body's immune system or specific drugs to fight cancer. Examples include trastuzumab, which is also known as Herceptin, for human epidermal growth factor receptor 2 positive breast cancers. Now, let's talk about its mechanism of action. It blocks signals that stimulate cancer growth or marks cancer cells for destruction. And side effects include fever, chills, and risk of heart issues in some cases. Drugs used in biological therapy are trastuzumab, pertuzumab, and lapatinib. Since treatment is given according to the staging of the tumor, the breast cancer is staged via two methods, which are TNM staging and Manchester staging. Let's discuss them one by one. Let's first talk about TNM staging. T for primary tumor, N for lymph node, and M for metastasis. There are 5 subdivisions of primary tumor: T0, T1, T2, T3, and T4. Now T0, here there is no evidence of primary tumor. In T1, the tumor is 2 cm or less in greatest diameter. In T2, the tumor size ranges from 2 to 5 cm. In T3, the tumor is greater than 5 cm, and in T4, tumor of any size with direct extension to chest wall or skin. Now there are 4 subdivisions of lymph node: N0, N1, N2, and N3. N0, no palpable axillary nodes. N2, mobile palpable axillary nodes. N2, fixed axillary nodes. And N3, fixed supraclavicular nodes. Now there are two subdivisions in M, which is metastasis, M0 and M1. M0, there is no evidence of distant metastasis, and in M1, there is distant metastasis. Now let's talk about Manchester staging. Here in Manchester staging, there are 4 stages. Stage 1, Stage 2, Stage 3 is further subdivided into 2, that is A and B, and there is Stage 4. Now let's discuss each stage. Stage 1, here the tumor size is less than 2 cm, there is no nodal involvement and no distant metastasis. Then in Stage 2, tumor size ranges from 2 to 5 cm, there is ipsilateral mobile nodal metastasis and no distant metastasis. Stage 3A, tumor size is greater than 5 cm, there is ipsilateral fixed nodal metastasis and no distant metastasis. In 3B, tumor of any size invading skin or chest wall, supraclavicular nodal metastasis, and no distant metastasis. While Stage 4, there can be a tumor of any size, there is nodal metastasis and distal metastasis. Breast cancer can also be staged as early breast cancer, which includes stage 1 and 2, locally advanced breast cancer, which is stage 3, and metastatic breast cancer, which is stage 4. Now, the treatment of stage 1 and 2, which is early breast cancer, includes surgery, chemotherapy, radiotherapy, hormone therapy, and biological therapy. Now, treatment of stage 3, which is locally advanced breast cancer, includes neoadjuvant chemotherapy, surgery, adjuvant chemotherapy, hormone therapy, and biological therapy. And lastly, the stage 4, which is metastatic breast cancer. So, the treatment includes palliative chemotherapy, radiotherapy, biological therapy, and hormone therapy. Together, we can fight breast cancer and save lives. And that's all for today's video. I hope you found it helpful, and subscribe for more videos on health and wellness, and share this video to raise awareness about breast cancer management. See you in the next video. Until then, take care.